Okay, welcome everyone. It is 9:05. I think that we will go ahead and get started. I am Laura Alfani. I am the Strengthening Families Washington team administrator. Typically, you'd see Nellie and Baja hosting and starting the meeting out, and she is on some extended leave back in just about a week and a half. And so I'm covering for this meeting and a few others as well. So I'm really glad that you're here to spend time with us. I see that we have a couple of folks that aren't regular attendees or are new. Glad that you're here. If you can go ahead and go to the next slide, Jessica, I think you're sharing screen. Just want to take a minute to do introductions. In the chat, please share your name and your organization and your role. And if you want to rename yourself to whether you're an HVAC member or you're part of the TRIO, which is our state team at DCOIF, Start Early, and Department of Health, to put that behind your name. Or if you're a public attendee or a guest, that would be great as well. We'll give it just a minute for people to introduce themselves in the chat. I just want to acknowledge you probably see my background that I am in my car right now. I had intended to drop off a kiddo at soccer camp and be in the office. And there's thunder and lightning. So lo and behold, I can't drop him off just yet. And so we're kind of scrambling to figure out if camp is still happening and we wait or if I head back somewhere else. So I will be off camera here in a little bit after I get started with the meeting and then pass it off to Gretchen to facilitate the next section and figure out our next step. So I'm glad that you're all here with us this morning. And I do imagine we'll have a few folks jumping in and out of the meeting over the 3 hours that we are together today. So grateful that you're able to be here. I also want to acknowledge that I did send out some materials ahead of the meeting, but the slides have not gone out yet. You'll see those in the chat here in a little bit as we get settled. So just want to acknowledge that that has not been sent out yet. Everyone for introducing yourself in the chat. Good morning, Allison. Good morning, Samantha. Good morning, Cynthia and Malia and Marlene and Alicia and Martha and Chloe and Monica. Hi, Chris. Good morning, Allison. Welcome, Ibrahim. Hey, Nicole. Welcome, Erica. See you. Good morning. And I think that Gretchen, after this part, is this where I hand it off to you for our housekeeping and ice breaker, ice melter? I've heard different terms recently. Yeah. Okay, I'm gonna go off camera. I'm gonna pass it to you, Gretchen.
Hey, thank you. Good morning, everybody. I'm Gretchen Toller. I am at Thurston County Public Health and Social Services. I'm co-chair with Marilyn, and I'm happy to be here with all of you today. Hopefully everybody is doing okay with the thunder and lightning and the rain. And I was telling Laura I was out for a walk with my dog, and we were about 1.5 miles out from the house, and the thunder really started roaring, and the dog was looking at me like, what are we doing? But I am secretly really happy about my lawn of getting a little rain, so it needs it. Okay, so HVAC housekeeping, the role of the advisory committee, it's up on your screen. I will let you go ahead and read that. And you have some questions or comments? No. Okay, to move on to the next slide. All right, and then the role of TRIO staff in HVAC. Attending HVAC business meetings as an observer, providing professional guidance and perspective. Policy and decision concerns or questions should be asked directly to Laura or Nicole via private chat or email, please. Ready? Okay to move on to the next slide. Welcome to the HVAC meeting for any public attendees. Glad that you are here. Guidelines for meeting participation is only HVAC members can vote or respond to polls. You can save comments and questions for the public portion of the meeting. That would be appreciated. And any technical difficulties, reach out via private message, please. Slide. HVAC values a portfolio approach to home visiting, diverse representation, funding, a range of capacity, and local implementing agency participation are all values. We hold. And next slide, please. HVAC goals to ensure access to home visiting services for families that could benefit most in Washington State. Establish a consistent and effective process to gather feedback from stakeholders regarding home visiting and to advise leadership regarding home visiting direction. Utilizing data to understand community need and disperse funding to communities that could benefit most. And then support home visiting services and being integrated and accessible in communities so that families can access services that fit their needs. Next is review of the agenda, and see that we'll do a community engagement activity here soon and look at the survey results after that from the previous meeting. And then approximately 9:30, we'll talk about membership for HVAC, take a little break, come back and talk about fiscal year 27 planning, take another break, and then come back and talk about DCYF decision packages before we wrap up with meeting feedback and doing a survey, or we'll get the link for the survey for this meeting. Any questions or concerns about the agenda? Hey, moving on to community engagement or community relationship building. So we're going to go into 3 breakout rooms and talk through the question of, noticing we're halfway through 2026, which is pretty hard to believe. How are you doing on your 2026 commitments and focus areas and any changes you want to make for the last 6 months? I was thinking yesterday, I don't know why it entered my head, I thought 5 months and we're going to be at Christmas time, which is crazy to think about. So this year is flying by. So I think, Jessica, are you doing the breakout groups?
Yes, Gretchen, and for about 10 minutes.
Okay, yeah. So we'll be in breakout groups for about 10 minutes and then hopefully come back together and can share a little bit of how people are feeling about their 2026 goals and commitments. But thank you. All right, is everybody back now? Okay, so we had 3 different groups. Would anybody like to share a little bit from their time with their group? Maybe I'll start from, I was in group 3 and we talked about just some of the changes that have happened with budget cuts and how that's shifted things for people, and a little bit about data, because maybe I was we were talking about data anyway, and so the office hours coming up today, which was great news to hear about, but just with budget cuts and that kind of getting regrounded, and slowing down, showing each other grace, and recognizing just the amount of stress people are under with all of these changes that are happening, either at the state or a lot of the LIAs.
I'll share. This is Monica.
And
Our
Monica,
group, we kind of talked about how we had some commitments, maybe some ideas or projects, and how hard it is in this current sort of chaotic, unpredictable world to pull the trigger on things that take innovation or inspiration or other kind of creative energies, because it's just more unpredictable times kind of draw you down a little bit. So, but then we wrapped it up with things that we're looking forward to.
anything standing out as something that people are looking forward to?
It was all personal, so
Okay.
personal things that are happening in our lives that keep us afloat.
Nice.
And looking forward to, vacations or visiting with family, things like that.
Okay. Yeah, sometimes I worry the summer is going too quickly with being so busy at work, and that I don't know, I'm just not feeling that time to slow down. Anybody else? Okay, so
If you want to hand it back to me, Gretchen, I can take
Okay.
it. I am in motion, but I'm happy to take it on. I think I can do the next piece.
Okay,
So is that okay?
perfect. Yeah,
Thank you. Thank you.
thanks, Laura.
Yep. I want to reflect appreciation for the group and the space that you make for relationships, and the fast pace and the work and all the things that are happening. I just appreciate the work that you do to build relationships and trust among the members of this group, and in the work that you do in community as well. So just wanted to say that. Wanted to just do a quick, this slide was actually in our deck the last meeting as well, in our June 2026 meeting, of some of the things that we covered over the last year. Take a breath and appreciate the milestones and the things that we did cover, and wanted to share this too, so you have this in mind as we look at both membership and our focus areas for the next year of what we focused on over the last year. So I won't read it to you, but just wanted to acknowledge that we did cover a lot of topics over the last year, and some new and emergent things that have come out of that we're hoping to explore with you all over the course of this meeting and the next several. Okay, so you can go to the next slide, please. The next slides just share what was the feedback from our survey. This is a practice that we've made a habit of, is just what people say. Is there anything we need to tweak or change about what we have done? So we had 5 Fund Visiting Advisory Committee members that participated in the survey, and hope that we have maybe a few more after this meeting and providing consistent feedback. So if you go to the next slide, it has the bulk of what was shared about what did you like about the meeting. So I'll let you read that. As a reminder, we talked about strategic planning and did some reflection on the maternal mortality recommendations report as a secondary conversation to the one that happened in April. Just a minute, and then you can go on to the next slide as well. Okay, what did you find challenging? A little bit more time in small groups. We will have one small group discussion today later, third element of our agenda today. So hopefully we have enough time. And if not, we'd like to have that feedback again. So appreciate that feedback. That was, I think, related to the strategic planning conversation last time. Next slide, please. What would you like to see changed? So I wanted to note this. I read this as some feedback about the process for sharing the survey link, and wanted to note I did email out the survey link ahead of the meeting, and it will also be an email again. And we did add some questions to it after our the home visiting kind of core planning group met on, gosh, what day was that? Wednesday last week, I think. We made some tweaks to it. And so just wanted to note that it was included in that, and we'll have it in the chat again, but we will also try to get it emailed out again after the meeting as well. Next slide. Anything else you'd like us to know? Looking forward to adding new members, lived experience, appreciated the strategic planning and the breakout groups. So just some notes there. We'll talk about some of those today as well. And then what would you like us to focus on? So wanted to note that some of these topics you'll see reflected in the focus area topics for this coming year, state fiscal year 27, which started this month and goes through June 2027. And a survey that went out ahead of the meeting, and we had 11 responses to that, and we'll share it here on the screen shortly as well. Go ahead. And then the last slide of this section is these were the themes that came out of the strategic planning conversation with the Home Visiting Advisory Committee. I'll talk about each one of them, I just mentioned each one briefly, but also wanted to note there were some really rich notes that Emily from the DCYF team put together as a synthesis of discussion. It was 4 pages. It was sent out ahead of the meeting, and we'll share it again. I think maybe that's what Jessica just sent in the chat. I'm not sure. This community engagement team is amazing at having everything queued up. So there was some really good and interesting feedback in that. So I want you all to just make sure you have that, review it, and a good reflection from our own internal DCOF community engagement team that there are some themes about what some of the advisory committees are sharing. And so we are thinking a little bit about how can we synthesize across advisory groups the feedback that has been shared in those strategic planning and share that across our DCOF divisions, because oftentimes the feedback from the advisory groups might go to a specific division. And is there a way for us to examine that in a more comprehensive way? And then we made a commitment to coming back to this group, I want to say in December or later in this calendar year, probably the last meeting of this calendar year, to talk again about strategic planning. So I appreciated these themes, home visitors feeling understood and supported by DCWF, increasing workforce well-being and sustainability efforts, funding stability, meeting the needs of high needs families, and reducing administrative burden and improving systems coordination were the themes again. And some of those resonated across advisory groups, like our early learning advisory group, our provider supports work group, and I think even some of our child welfare advisory groups as well. So I believe the next couple of slides are just a discussion reflection from anything that was just shared. So first open it up to Home Visiting Advisory Committee members, anything that you want to lift up from what was shared in the survey, feedback from the June 11th meeting or the strategic planning. So just give it a minute for anyone to share, and then after this, open it up to public members for any thoughts or reflections. Okay, why don't you go on to the next?
Oh, I had
Oh,
my
yeah.
hand up. Oh,
Yes,
it's okay.
please,
I'm
Erica.
sorry.
Sorry, I
Is
didn't
it?
see that. I'm sorry
Oh,
about
no,
that.
that's all good. This is Erica Halleck representing the Home Visiting Advocacy Coalition. I want to thank everyone for the conversation on the strategic plan and the great summary. I think the comments made really resonate, and I think lay a wonderful path for further conversation and really bring up for me what can be the next steps. So I think the way this is organized really lay out as advocates and as an advisory committee, how can we look at tackling these very important questions for the health of the and sustainability of the home visiting field so that the children and families in our state can continue to be well served by home visiting in our state. So I'm excited to have this document to help continue to guide the work. So thanks to everyone who contributed and put this together.
Yeah, and I just invite people to have that up also during the conversation about focus areas in case there was something that was reflected in that survey that is not reflected in the topics that we'll discuss in a little bit here. So just making sure that you have a chance to look at both of those. Okay, and if you're raising your hands, I'm sorry if I'm not seeing it, so I'll ask other people to help me call people in because I'm on my phone, but just got home and we'll set up here at home in just a second. Okay, we're going to transition into the membership planning conversation. And as you can hear, my little guy who was not expecting me to be home is here at my lap now. And being a little fussy. Why don't you go to the next slide? Okay, so here's the goals of the conversation for the membership discussion. I just want to project for you all that we will have some polls at the end of this. And what we're really hoping for, okay, take it off. What we're really hoping for is that we can explore who and what voices we'd like to have and help guide a working group that would work through some of the membership focus areas over the next year. Okay, I'm going to pause for just 1 second. I think today is just testing all of my limits of adaptability. Okay, so we want to just do some focus on who we want to bring into the membership discussion, what voices and perspectives. And so far, our wonderful fearless Allison has offered to participate in this working group, but we need a few more. We need a few more people that can commit to helping do this work. So today, what we hope is to be able to narrow down and support that group to have some focus over the next few months. So if you can go to the next slide, please. Okay, so this is our current membership. HVAC has 20 to 25 member spots that represents home visiting experts, government, health department, tribal service providers, research and evaluation, and community partners. So we have about 6 to 8 representatives from home visiting programs and representatives across a few different models. And you'll see in just a few slides kind of what participation is looking like to help us guide our conversation for the next year. Go ahead to the next slide. So here is the membership. We have 21 people that are kind of listed as members at this point. We've kind of had an on and off process for length of participation. And after looking at the attendance over the last few meetings, there's been 3 in 2026, and we're looking at 2025. We had about 50 to 60% of members attending regularly, so 11 to 13 regular attendees. That wasn't always the same people, but fairly consistent we have. So over the next few slides, you'll see kind of where the participation is at. So what we'd like is to have closer to 20 to 25 regular attendees at meetings, and expand a bit on the voices that we're hearing. Okay, go ahead. And the voices we're hearing are wonderful, but we'd like to have a few more regularly there. So here is the distribution kind of profile, if you will, of participants. I don't think my numbers are quite accurate here where it says 19 active members. I think it's probably a little bit less than that as well. So we let you look at that for a minute. And just also noting, like, we know that members might represent multiple different sectors, if you will, in your work. You might be both a service provider but have a strong data lens, or you might be situated in a higher education agency but also a service provider. So just acknowledging this is not a clean cut kind of thing. Okay, next slide, please. Okay, so here is our allied professionals. We have about half regularly attending and engaging in this, and representing different state agencies, community partners here, and systems partners. So just acknowledging that. Want some water? Okay, next slide. I believe might be our program slide. Oh, nope, our advocacy and higher education. So Erica for the Advocacy Coalition, and Monica joining us from University of Washington. And next slide. Our home visiting programs. And I sure hope I didn't miss anyone on this one. I looked carefully at it a few times. We had one of our program representatives who's actually still here, Samantha, our wonderful colleague. The program is no longer providing services, so we had a shift there, and Samantha shifting into a partner role. Next slide, please. Desired voices and perspectives. So if I missed you at one, I just apologize. It was just an oversight, no other purpose behind that. Desired voices and perspectives. This is one of the things that we've talked about, lived experts. So does that mean program graduates? Does it mean home visitors? We've had some conversation about that. Research and evaluation perspective, higher education, again, kind of thinking about workforce and workforce development, community health perspective, and advocacy perspective or lens as well. And then, of course, our local home visiting programs. So that is a bit of kind of what we've discussed as far as who we would hope we could engage in this work. And then the goal of the working committee, Erica, I do see your hand now, but if anyone else has their hands up, after I get talk through this slide, then I'll call on you. So what we're hoping for is to have, I don't know, 3 to 4 people kind of take the feedback that this group discusses today. We'll have a discussion and some polls to just help narrow some of that down. to help identify, who we could recruit to support their recruitment. DCYF will provide staffing for this. And then to support the updating of the onboarding materials and supporting that kind of onboarding process. So like a 4 meeting kind of structure is what we're thinking. So it's not a full committee, but it's a working group to kind of activate getting new members engaged, would be the goal of this work group. Erica, please.
Thanks, Laura. I'm just wondering about the interest in additional advocacy voice and if the coalition can be helpful. I know I raised to the group that um, there's outreach to bring on new voices, and we're talking about potentially having a new representative rather, since I've been doing it for a while. So if there's assistance we can provide that coalition, we're happy to do so in for that space.
Yes, please, and thank you. I think at one point we had 2 voices, Erica. Lori Leopold joined as well as you, and so I think in some ways it might be helpful to have just, more than one.
Absolutely. Yeah. And bring that to the
Thank
group.
you for that. Yeah, thank you. Okay, anyone else? Yeah, I want coffee, huh? I don't have coffee. Now, what happened to my Zoom? There it went. Okay, any other questions? All right, let's go to the next slide because I think it might be the discussion slide. Yeah. So this is just discussion. Any what questions come up for you? What ideas do you have? And then we'll have a poll here that we're going to ask those 3 specific poll questions about number, and then kind of focus of recruitment, and then can you commit to being on that group? So before we do that poll, wanted to have a discussion with you all about what's missing, what do you see, what would you like to see as it relates to membership and engagement.
From my point of view, I would love to have a mixture of people on rates, off rates, so that there can, just be a full discussion when things come up around that. And also, I know it, and I'm not saying you guys don't have something. I mean, it totally could be on me. Throw myself under the bus. Um, the expectation of what you're wanting really from a member, what's the minimum an HVAC member could do, and what would be the benefit of being an HVAC member, what is the results of being involved. So maybe that's motivating for people as well. Like, oh, they talked about this and this changed how we do our work. Because we're all asked to be on lots of different groups, meetings, another Zoom, all of that. And sometimes you just have to really prioritize what you think is going to make a difference. And so if there's a way to really kind of hone in on that, I know we always say we like hearing about the updates from Erica and what's happening, and people outside of being members probably don't get to have that. And I think that would be something that we could highlight. I'm just thinking as real life providers, what you're willing to give 3 hours up to attend. So that's just a couple of my ideas. Thanks.
I think it might be helpful to have a couple home visitors. We've got supervisors on, but it would be really great to have a couple just boots on the ground peeps to really be able to give a perspective.
And I actually was going to say the same thing. I really think we need people
Okay.
who are in the field doing the work as the closest, feedback loop for us. And I didn't know if all of the home visiting models that are represented, it seems like they're probably leadership or supervisors, as Christy just said. And so, can we do that? And to Allison's point, that's a lot of time, right, for a home visitor. But I think it's kind of critical. And is there any way to negotiate with organizations to, provide time release? But I think that's the critical piece that we're missing is the boots on the ground. Um, but I also know it's going to be hard for any home visitor to commit the time if they're not given permission from their employer and encouragement, and even maybe to Allison's point, recognition for doing this as a part of their role.
I love the idea of how, and I was hoping to bring that up as well, but I think going back to, we've talked about having parents on HVAC as well. And I think that if we're going to have home visitors and parents, that we need to also be willing to invest time in supporting them to onboard in a way that feels good to them, because we do talk about some really complex stuff that might be new to them. And I would hate for them to come into this space without enough support in those early days and feel overwhelmed or feel like they didn't want to bring their voice to it because they didn't know, or they might not understand, exactly what's happening. So I think that we need to really invest some background information for folks so that they can come in and feel confident in their space. And then the other thing I was going to bring up is that, if we do start working on, terms and whatnot, I think that staggering that would be really helpful. I know having voices in the room that have been around for a while, that is really helpful, but then having new voices is also really helpful. So figuring out exactly how to balance that out, so that we don't end up with like a mass exodus of programs or just members in general, and then all new people that take a long time to get caught up to what these conversations have been and what the history might have been.
Kind of getting the sense a little bit around, um, to me, I am like just thinking about if we were to focus on home visitors as like that is the lived expert voice at this group versus parents, being that they are both lived experts in different ways. But to me, I'm wondering if we should identify one of those focus areas to develop over the next year. I think it might be ambitious and challenging for us to try to do both. So I would be curious about for this group, like which direction might be a focus. Parents and thinking about that, or the workforce, home visitors.
I was actually thinking back on like the content that we've been exposed to, the discussions, all of that, and I'm having a harder time feeling how parents would feel connected to that in a way where they could contribute. And I may be totally misspeaking here, but it feels a little bit more removed from a parent perspective, but very connected to the home visiting experience of being in this workforce. Like the topic areas seem to align with the home visitor in a more direct way in my brain than it would with a parent. And I was literally playing in my head, like, what were the, what were the topics? What were the things we worked on? And who would, how would people contribute to that? So that's just my 2 cents.
If we were doing a two-step process, that might be good to really take a look at the parent advisory committee for the state and make sure that we have good representation across all programs. And then that would be like they're getting their feet wet. They're working with other parents from ECAP and home visiting and all the other groups that they're pulling from. And then maybe eventually that becomes the growth. Now they've been a part of an advisory where there's a comfort zone. And then we, a couple years down the line, pull a couple parents from there to then serve on this one. Might be a way to to get representation, just in a slow step, I guess. Yeah.
Laura, this is a little off, it's not off topic, but it's not on those same groups. I know I've brought this up around sustainability, and I just wonder if there's space for it, like as far as like membership goes, thinking about how HVSA, the intention was it to be public private rated funding initially, and that over time it seems like it's more public funding and not so much private being involved anymore. You know, just I think as time has it's gone on, and it makes me wonder if there would be membership opportunities to pull back or pull in some people that could help us, if that's the direction that we want to be going with, like re-exploring, like getting some of those private partners or funding back into the equation. I guess thinking about like, you know, philanthropy groups or I don't know, somebody. But if I'm fully off course, that's fine too.
Any other thoughts or discussion? Otherwise, we'll move it to the public discussion. Okay, so here's the poll questions. And again, we might have like missed what the right questions are based on the discussion, but we're gonna test it out and see what we get from this conversation. So just a reminder, we have okay. Okay, wait till just a minute. I'll be right there. Again, today is just the test of every adaptability muscle that I have. Now people are knocking on my door. I have no idea what's going on. Um, is how many people do we want to focus recruitment on? And this is important because we want the working group to have a focus, right? So right now, you know, it's been our goal to have 20 to 25 regular attendees. We've been having 10 to kind of 13 or so regular attendees at our meetings. Where do we want the recruitment focus to be? And we said select up to 2. And so please, you know, adhere to that if you can. We can't control if you pick more than 2 because we can't limit it, but we like you to pick no more than 2. And then the last one is, can you commit to the working group? Our goal is, you know, 3 to 4 members. 3 to 4 members, and it's a yes/no question. So I'm going to ask our community engagement team to launch that poll. It's 3 questions. Please, if you're an HVAC member, answer all 3 of them.
Laura, for selecting on recruitment focus, we talked about home visitors. What would we choose for number 2 to make that a recruitment focus?
Why don't you pick lived experts and then maybe make a comment in chat about that as well. Okay, and then I also wanted to note that if you have someone in mind that you think would be a good person as a member, then please do chat Jessica Spencer. So to do a direct chat, in your chat, you hit new chat, and then you pick the person that you want to that message to go to.
So just to point out, I put lived experts and some people are endorsing that. That's a nice way to kind of get a poll of that piece that the experts with lived experience could be home visitors.
Okay, can you show the poll, Jessica? Do we have pretty good responses at this?
Yeah, 8 people. Do you want me to close it? I'll close it.
I have a question. It says, if you have someone in mind, is there any, besides reaching out to someone, like, we have a listserv, we could send out a, advertisement or whatever. But the idea of them participating, being supported by their organization or compensated, or the organization compensated, or so rather than just asking someone as a one-off, is there any, way to also support their involvement?
That's I think, are you talking, Monica, specifically about a home visitor or a person maybe that doesn't fit that category but doesn't? Go ahead.
Specifically, home visitors would find it pretty hard to do a 3 or 4 hour meeting, and they would need support from their organization to do that.
Yes. So those, I think that's kind of what we're hoping the working group would talk through and then make a recommendation. And then I think DCYF will have to do some exploration about, do we have the policies and funding in place to be able to make that happen? We can certainly support it from the kind of engaging with the organization, but then how some of the compensation or release of other duties might work, I think there's some exploration there. But I think the working group should kind of work through just the questions that you talked through, and make a recommendation for how that could look to have home visitors, because that would be a new group. And I think it's a great, I'm seeing a lot of support for that. Does that answer your question, Monica? Go ahead, Christy.
I was going to say that it would be different from a release time, like in our case, because all my team are maxed out on hours. They're actually working more than what the timesheet even shows. And so I can't even pull them like working at the college back in the day when we were at, you know, in a different scenario. They might have other roles that I could use that time. But in my case, it would be I don't have any compensation and we can't pull back on home visits because we need the deliverables. So yeah, that's definitely something to really kind of keep in mind. If there's a little bit of some type of compensation that could just be added to a contract or whatever, that would be helpful for whatever team, whose ever team. Thanks.
I was just gonna kind of echo Christy what you said is that like bigger programs, like my program is fairly robust and I can potentially shift caseload and give someone a slightly bigger caseload to make time for somebody else to participate. But then that would limit the potential for the lived experts, home visitors to only come from bigger programs, which may not give us the robust piece. So I don't know that I know a solution to that, but if we want to be able to have folks that represent the entire spectrum of what home visiting looks like, it might be easier for bigger programs to absorb that, whereas it might be nearly impossible for smaller programs.
Piggybacking on that, we definitely want large and small, just like rural and city. So that is something to really consider.
I saw in the poll that there is a good number of people, I didn't see exactly who or how many, that said yes to that working group. So I think we have something to work with. And Allison, thank you for being a fearless leader ahead of Allison Bowen for offering to support that, and then the others that came along today. So you can expect, you want coffee? I don't have coffee here. I can expect, you can expect a communication in the next probably 2 weeks, trying to get something scheduled. It's empty. It's empty. Yeah. Yeah, it is empty. About that. So I really appreciate you all, and I think we saw some clear focus areas. So kudos. That was a big hefty part of our first agenda element here. And I think if we go to the next slide, we might be at a break, and I'm going to send us to a break for 10 minutes. So please be back at 10:20, we'll say 11. And then we're going to talk about our state fiscal year 27 focus areas, and Gretchen will facilitate us through that. Thank you all for digging in and for grace and patience with me as I am navigating every kind of a bump today. So see you in 10. Okay, welcome back. Welcome back. If you are with us, and even if you have a camera, no problem, you can give a quick reaction or turn your camera on. We'll know you're back, whatever works for you. Gretchen, I'm going to check in with you and see if I can get it handed off to you to take on our next section. Go ahead.
Sounds great. Okay, welcome back, everybody. Sun's starting to peek out here, so hopefully it's the same for others. All right, so first up, this is meeting schedule for state fiscal year 27. I think we decided to make a few movements, like moving away from December and moving to January. So we've got September 17th, November 19th, January 21st, April 27th, and June 7th. Next slide, please. And then these are the topics that have been our focus over the last year, some of which we carry forward if we would like. So there's been a lot of interest around budget and HVAC fund balance and down, expansion plan, HVAC recommendation progress, data recruitment, ecosystem, early learning coordination plan, rate setting and HVAC goals by membership and lived experience compensation. Um, how do we want to add to the end? Thoughts on that before we move forward? Okay, next slide. And then these are the topics that have been raised as a focus of interest and could be explored for conversation or um, for the coming year. The ones with the asterisk, I believe, are ones that have typically been topics that were on the last slide that continue to carry forward often. So again, the fund balance and legislative process is always really helpful when Erica gives us updates and explains some of that. And then rural services, serving high acuity families. I think that was one that came up from the maternal and mortality maybe report. And then HVAC membership.
Gretchen,
And
I'm
yeah.
sorry, I'm having a little trouble hearing you. It may be just me. It's a little garbled.
Oh, okay.
Sorry.
Is it any better now?
Yes, thank you.
Okay. Try to use my outside voice. Do you want me to repeat anything? No. Okay. Any thoughts on this before moving forward? Okay. Okay, so this is the survey results. When the survey went out around topics, I think I want to say that went out like over the last 3 weeks. Is that right, Laura? I'm trying to remember. It wasn't too long ago. Okay.
Yep, within the last few weeks.
Okay. So you can see rates and sustainability is something that people are really interested in. And then service indicators looks like it came in second. And then there's some areas that, align like with training and whatnot, and the SED treatment or training for home visitors and supervisors, performance measures, rural services, birthing hospitals closing. And then exploring family connects and priority populations. So a lot of interest in all of those. So, the question is like, what's missing? Like what wasn't captured on the survey that's coming to mind for people? And is there anything that's standing out as something that we want to hear about regularly? I know when we were talking about membership, somebody brought up, and I can't remember who, but it was a great idea about having representation from both models that are have rates funding, and then those that don't have rates funding. So seems like that would fit in nicely with the interest that we're seeing for rates and sustainability. Any questions for HVAC members or discussions? Anything that we were seeing on the survey results is an area that we really want to dig into or have concentrated support on?
Erica had noted earlier the DCY strategic planning topic, like that summary document. And if people have had a chance to look at that, which was emailed out earlier and put in the chat, if there's anything that was on there that you haven't seen, might be a place to offer those as well.
On break, I had a thought. Occasionally, I have those. And I was thinking that it might be nice to have somebody that is more in the ESID world than the home visiting world involved on our HVAC as well when we think about other agencies. And so we've had a super great relationship with Child Strive, and they've always been really willing to come and talk and meet with us. So I was thinking maybe I could reach out to their director and see if they would be interested. I just don't know if other people that are members would find value in having early intervention service team members part of this. I mean, they do home visits in the sense that they do therapies with kids. It's just not quite the same as home visiting. But my secret reason is we know like a very small percentage of the kids that could benefit from ESIT services are actually receiving them. And so if there's a way to build those bridges between our groups, I think it would be great. So
I think
Yeah.
to kind of tag on to that, I would say, I think they bring another lens of what families are experiencing, that they're seeing and experiencing as well, without necessarily having parents in this group right away. I think that would be another way to get a lens from somebody who's in the home sometimes, and yes, they're providing therapy, but they're still seeing what families are experiencing.
Is that an area or a topic that would be that we would want to maybe explore having someone sure, like getting more information on that, or how to
I
strengthen
was
those
just saying
connections?
I could make I'd be willing to reach out to the director at Child Stride to see if she has somebody that might want to be part of our group, and then just kind of go from there. I don't know if we need to have like a whole topic or meeting on it, but maybe as that person gets involved, they would be able to share more information. But
Great, thank you.
feel like I should go home now because somebody said it was a good idea. And I don't know that I'm going to top myself today then. So
Maybe just call it a day now, right? All right. Okay, we would like to consider 3 subgroups within the HVAC. So just as a reminder, we have had 2 to 3 ongoing subcommittees in the past. There was the workforce development and data subcommittee. The idea is to transition to working groups that focus on topical specific issues, such as those identified in the surveys or other emergent areas. So we're hoping to have at least 3 small groups over the next 2 years. DCYF Trio will staff these and would like to have HVAC members and HVSA partners participate in this. So the family acuity group has some information already went out on that and it gotten scheduled for first meeting in August. And like I mentioned, we've had the workforce development and data subcommittees, but trying to move those into like more time limited groups and really focused on certain pieces with that. So the other areas of consideration are bringing forth family voice and leadership, and then rates and sustainability, which clearly was the winner on a topic poll of an area that people want to have more information about. So with this, there's another opportunity with a poll. So with it, we want to select no more than 2 groups that might be of interest to you. And then with the meeting reflection survey, you could submit 1 person who you think might be a good fit and to include in a work group if they are not here to put their name forward. And it doesn't have to be an HVAC member or partner, correct, Laura? It can be, okay. All right, so the poll is up. If everybody could answer these, selecting 2.
I think that echoing for echo.
I'm just sitting here thinking about an interesting way to bring the family leadership and voice to the table. I have a home visitor that has a small team of our parents. I know that we have other teams across the state that have a parent leadership component. What if that were like a little saucer that is swirling outside of our meetings per se, but that we could send information to those who are leading parents to be able to get information who can get it back to us. I mean, we have that component and that capacity to be able to do that, but not if we're thinking about having a 2-step process, get some home visitors at the table first, and then eventually bring parents once we figure out how we could train them to feel comfortable at the table. We have ready access to families who are already saying, yes, I want leadership. And so maybe that would be their comfort zone as they work with their own home visitor who is leading them right now. But we get that person to get the information, like Annette could get information to me to bring back to this group. So maybe we could have a little, I mean, just a thought. The parents are there across the state of Washington because before we started our leadership, we connected with a couple groups that had leadership going. So it might be a way to kind of extend the opportunity, but come in a comfort way.
Thank you, Christy. Really great idea. All right. So it looks like we've got 75% for rates and sustainability, 50% for service integration for family acuity group, and then workforce development and data and evaluation are tied at 38%. Any thoughts around that for anybody?
interesting that the 38s are both of the groups that we've had going for a few years. So it looks like we're looking for some new avenues to go down as a group.
Mhm. Yeah. I mean, all of it's important. It's hard to just choose two. All right. We can move to the next slide. So thinking about our agenda for our next meeting, which is September 17th, are there topics that are coming to mind for people that they would like to have on that agenda? I mean, obviously we just like did that poll and then we got surveys. So I think there's some things that are on people's mind, but doesn't necessarily mean that they want to hear about it at the next meeting. So, and then just seeing Martha's message, maybe the data and evaluation could shift to a topic specific as needed work group that is available to respond to issues or questions of same search. Yeah, that would be great, Martha.
Would there be information in September available about the status of the HVSA funding? I know that we get that 2 times a year. Would that be timely?
It is possible we will still be, the agency is typically still closing the fiscal year, even in September. But we could, and possibly, we might be able to have a kind of like a draft update. It wouldn't be a final fiscal close, but that's certainly a possibility. Beyond the kind of what's going on with the account and the account balance, if there is any, is there anything else that the group would want to hear about as it relates to budget sustainability? There's a lot of different facets that could be explored, I guess. So I would be curious about what additional topics the group might be interested in.
I would say, Laura, and I don't want to push in terms of timing, because I know that's outside of your control with the closing of the books, but I think that would be helpful to get a status on that whenever we're able to do that, get that update. So if that's October, or like, I don't think we meet in October, right? November. Um, that would be helpful. And I need to think a second about what other information would be helpful. And I'm sure others have ideas too.
Laura, I wonder about with thinking about rates, is any updates on I think one thing that we were waiting for was McVie to be approved for rates, and if there's been any further conversations on that, and what are the other barriers to moving forward with rates? With funding being what it is at the state, is that putting rates, full implementation of that on hold until the budget is better, or what that looks like. And I'll tell you, this tells me how tired my brain is, that I know rates was one of the top ones, and now I'm trying to remember what the other top one was that I just said off the poll. Was it
Service
acuity?
integration, which I think
Oh,
was
okay.
it was a kind of a mix of some of the acuity systems coordination pieces. There was a few different topics that I think it assumed that group might be. I think that was the second.
Okay.
I have one, an update on, I remember we voted recently, I say recently, I use the word recently when I can't remember when it was, on the effort to reinstate a program in Spokane. So maybe updates on some of those previous actions would be really helpful. Like just status updates would be great.
Yeah, and the NFP change in Skagit County update. If there's an update there, would be great. Erica. Anything else coming to mind for people?
Thank you, Allison. I see your chat too, of having to hop at 11. Anyone making sure everyone sees the chat?
Just an update on any anticipated new training opportunities that we can add to the start early list.
All right, any other thoughts? It sounds like we've got some good options in September meeting.
That sounds good. And if the membership committee meets ahead of that, not committee, excuse me, work group, and the same with the service integration work group, hopefully we can have some report outs from those groups about initial conversations as well. Okay, any other conversation from our public and trio member colleagues and participants that are here?
Hey, thank you, everybody.
Awesome. That helps us with our planning for the next meeting. So we now have a DCYF request legislation conversation that we're going to have. This is part of our policy input that we do. I am going to just do a quick time check. We are a little ahead of schedule. We had planned to enter into this conversation about 11. And our leader for our division, Vicky Ibarra, is not here just yet. So I want to ask the group if you are okay for us to take a quick break. And we had not, I don't think, planned it in at this moment to have another break, but I would like for this group, if that's okay, for us to reconvene at 10:55 to give Vicky a chance to log on and get settled as well. So I'll put it in the chat. But let's do a break for, and I don't know, community engagement team, if you can put that 10-minute break slide up really quickly, and then we'll come back to this conversation. But I'm going to put it in the chat too. So let's come back at 10:55. And then we have a number of folks here from DCYF that will be jumping in to talk about this. So I want to make sure everyone has a chance to introduce themselves. So see you shortly. Go ahead.
There's nothing quite like the recording in progress just as you go off mute to speak. Good morning, everybody. I'm Jennifer Personius, JP. I am the Senior Policy Advisor for Government Affairs that's assigned to the home visiting portfolio in PPS. I'm glad to be here this morning. Julie?
Hi, I'm Julie Watts, Deputy Director for Government Affairs for DCYF.
Thank you, Cynthia.
Good morning. I'm Cynthia Juarez, and I'm the Director of Family and Community Support within the PPS division at DCYF.
Awesome, thank you. And I know Vicky Ibarra, who's our Assistant Secretary of Partnership Prevention and Services, will be online here in just a second as well. Will be joining us. Just a quick note, so just what you'll see here in a minute on the slides, and then we will have breakout groups to discuss and then come back together as a group to do a quick group share out. So the next part of our time together will be doing a bit of a policy overview broadly, and then specifically discussing some what's called agency request legislation that DCYF is considering for submitting in this current cycle of legislative request, and then would like to have your discussion on it as well. So if you could go ahead to the next slide, JP, I think you're our lead off hitter here. To talk about this piece, and just wanted to flag for you, will you watch for Vicky to join? Because I think there's a couple slides I believe that she was one to jump in on.
Okay.
So yeah.
That's fine. Happy to do that. This is sort of the general overview. It's not sort of, it is the general overview of how the legislative session works at DCYF. It addresses kind of how we as a state agency go through the process and how we interact with the governor's office and OFM and where the legislature comes into play. Right now, we are in the phase of developing our legislative and budget proposals. We have revenue forecasts in June that give us an idea of how the budget is going to look for next year. Right now, it's not been positive. But we are developing our agency request legislation would be where we're asking for a change in the law, and decision packages are where we ask for that's the budget proposal where we're asking for funding to take an action of sorts. Those will be submitted in September through the standard channels. We're working with our budget team now to cost out those budget proposals, and we work with the AG's office to develop the agency request legislation. So that's where we're at. I don't want to get too far ahead of the slides. So Laura, let's go on to the next one.
Yeah, I think the next one is okay. Why don't you go ahead?
Okay, sounds good.
One too.
So we have received our budget instructions from OFM based on the last revenue forecast. It is, there's quite a big deficit in the state. So we are making sure that we prioritize our core services and our essential services to protect safety of the children and youth in our care. We are proposing a budget. We have a budget proposal for addressing critical incidents, continuing the work that was done last year or last session. And we are making investments in JR for the safety and really rehabilitation of those young folks. And then we have requests in that address audit findings as well. So is this one you want Vicky to speak to, or?
No, I think it's okay. Go for it.
So I have, what we have is a table that looks at the funding for the home visiting services account. As you know, it is a special account in the state that blends funding from multiple sources, all to be used for home visiting. What we have is 3 state funds and one, the federal McVie grant. This shows for the last 3 fiscal years the total home visiting budget and how much came from each source. So it was, as we inform the discussion later, this gives you an idea of how much we are getting from each state and federal funding in the account. So one of our, unless you tell me differently, Laura, I'm just going to keep going.
It's okay. I don't see Vicky, and I'm not sure why she's not here, but that's okay.
That's
I'm
okay.
expecting she jump on at any time. So
okay. So the agency request legislation that we are putting together this year, this session, is intended to address some of the issues that we've identified in working with the home visiting account. So over the last few years, as the state and federal dollars, accounting, reporting, underfund, underspent, all of the different attention on the account, the different um, questions that we've gotten. We would like to, let's see, we would like to change the legislation so that we can separate out addressing some of the challenges that we've had. So when we had more opportunity to carry state dollars forward, the blended account made sense because the money would just stay where it was. Because the budget situation has changed, that underspend is returned to the state at the end of the fiscal year. The challenges in accounting with state and federal dollars, because they're on different fiscal years, the one starts in July, one starts in September, or in October. We have drawdown periods for funds, how they are able to be spent, what the federal dollars have one limitation of how you get the money reimbursed to you, and state dollars have different ones. So those things come together to have really caused some confusion about the actual balance of the account and what is available for spending. And when we have federal dollars in the account, there are additional federal accounting requirements that apply to all the funds, which require more work for our fiscal team. So we can go to the next slide. So our ARL, the intention of the revisions that we're proposing or considering, are intended to alleviate some of that confusion. Because the proposal is to separate out state dollars and federal dollars, we expect that we will be able to account more clearly for what are the state dollars, what are the federal dollars, what has been spent, what hasn't. There will be an easier time for our federal or our fiscal team to manage the account. And one thing we want to be really clear about is that any change we make would be on the back end, so that would not affect provider contracts or how the funds are spent. We don't expect a reduction in spending. We just are attempting to account for it a little bit more clearly.
I just want to acknowledge, I think that Vicki is here, and Vicki is
Great.
Joining us from vacation. So
we appreciate you, Vicki. Thank you
for joining us this morning. So just want to pause here quickly. JP did a great job talking through the slides so far. And just wanted to give you a moment to catch up with us, Vicki, as we have, I think, maybe just one or two more slides before we move into discussion.
Yeah, thanks. I appreciate JP. I appreciate your help with this. So as I'm sure has already been said, we are looking for a way to be able to better manage this account. Mostly these are, as JP said, backside changes. Currently, what we're seeing in the last two budget cycles with the legislature having swept the unspent balance in the HVSA, what we're seeing is that the legislature is now treating this like a year-to-year, biennium-to-biennium managed account, assuming, even in the face of additional knowledge, that any unspent funds are unneeded funds. So we've not been able, and the program has not been able to benefit from this being a multi-biennial account. We expect this approach to continue as long as the legislature is dealing with a down budget cycle. And so that's one of the reasons that we want to consider making some structure changes at this time. The the change that we would recommend as the program is that it be changed to a state-only account so that it holds only state dollars and not the federal dollars. This would allow us to retain the dedicated account for state funding that would technically cross biennial years, although during down budget cycles, we would propose not to manage it that way in order to not risk the sweeping of any additional funds. And this would, as JP said, move the federal dollars to annual non-dedicated funds, a regular federal grant management. It would not reduce funds at all. It would just allow us to manage those a little bit more easily. Of course, an option remains to request that we eliminate the account and manage it just like any other line item program budget that DCYF has. That would not be what we would recommend because that eliminates the potential benefit of a multi-biennial account in the future. But that would also be an option. Thanks.
So now we're in a discussion space for this. And before we move into breakout groups, wanted to just make sure that people have an opportunity to make meaning together, ask questions generally as a full group, and then we'll have a facilitated discussion as 3 small groups, 2 HVAC groups, and a trio public group as well. So opening it up at this point for kind of general questions and thoughts before we do breakout groups where can have a little bit more dialed in conversation. Erica.
Thank you. And thanks everyone for this great overview. It's super helpful. Can I just get clarification? I have a clarifying question regarding the last slide that Vicky shared. You made a comment about an option to, can you go back to that last slide? Could you discuss, I think I need a little clarification on what so I understand, I think what the left side means. That was what JP was discussing about separating out the federal and the state. I'm not sure what the right side of this means. If someone could speak to that further, that would be really helpful. Thank you.
Sure. Eliminating the special account would simply revert both federal and state funds to being managed as any other federal and state funds are managed inside DCYF. As you know, most of our programs, think about ESIT, for example, most of our programs are allocated by the legislature. The state portion of the money is allocated by fiscal year over the course of a biennium, and then the federal funds have their own requirement generally that we spend the funds within 2 or 3 years of the time that they are allocated. So it's managed as a line item budget with particular beginning dates and end dates for when the funds have to be spent. So if the special account were eliminated, presumably HV state and HV federal would revert to being managed as those line item funds rather than this larger multi-biennial account. Right now, the account technically allows us to spend state dollars outside of the biennium, although in practice, as we've seen over the last couple of cycles, that the legislature has not allowed us to do that. But in theory, at least, it allows us to spend money outside of the biennial cycle. Eliminating the account would revert it to a biennial line item that had to be spent. The state dollars have to be spent within the biennium. Sorry, I feel like I used too many words to explain that.
No, that's helpful. Can I ask a follow-up question? So structurally, the first option, and I apologize, I'm probably going to get a little weedy here, so I might be talking to JP and Julie. This would require the current statute, maybe just striking the federal from the current statute. What would the second option require in current statute?
I believe we would be striking the statute itself, basically repealing the statute that created the HVSA.
So that would mean potentially striking the other parts of statute that have beyond just we're putting federal and state money in the account and be striking the other portions like the direction for the advisory committee that we're part of here today, things like that.
We are not considering eliminating any of those other pieces. So just to be clear, we're not proposing eliminating any of those other pieces.
Okay, thank you. Thank you for that.
Chloe, please go ahead.
Hey, I'm sorry, Erica. I was totally not in the weeds with you, and I feel like I'm not an expert in this all, so this might feel silly just asking some of these questions, but I'm trying to understand. Does anybody have a little bit of the history about like why the services count was separated and like the intentionality and purpose originally, like as it was pulled out? Was it just about spending with the biennium and working through that, or was there anything else that was considered back whatever day that was?
I could give a little bit of background, unless Vicky, you wanted to.
No, I wasn't here. I came to Dell in 2016, so I wasn't here when the account was created.
Yeah, the account went through, I think, some various iterations over the years since it was first created, I believe back in 2011 or so. At first it kind of was really designed as a public-private partnership, and there were private dollars that were kind of commingled with state dollars. And then later we amended the law again to require that federal funds be placed into the account. And I think, a lot of the intention around, having the account and having these funds commingle was that we were really building up a service line. And so that, having all of those funds together in the same place allowed for some carryover as there were more, we were building out a service line. This is this is the only state account like this that I'm aware of that kind of mingles all of these different fund sources into one account, especially with the federal and the state. And so I just say, one of I think the challenges and the issues with having an account like this has been that it's been very unclear um, about the differences between the state and federal spending authority. That's created confusion with state lawmakers, attempts to sweep more dollars than we actually had available, attempts to change the spending authority that we've had to push back on. And so it's just created a lot of confusion. So I think the other, reason to do this is, the state has in several other accounts moved federal dollars and state dollars separate, particularly under the Trump administration when we're in a position of having to defend spend for federal fund sources to the Trump administration, where they've kind of had a little bit different look than previous administrations at the dollars. And so those are, I think, two reasons. One is just to create, more daylight into the amount of money or spend in the accounts and spending authority in the accounts by separating out the state and the federal, but also just wanting to have the state and federal funds separate because it does create a different additional accounting that we have to do of those state funds when we mix the state and federal funds together.
Thanks. Sorry, follow-up question. I mean, I understand like the state and the feds having totally different systems and timelines, and that's a lot to kind of navigate within the same pot for sure. Um, and it sounds like maybe part of the original development was a little bit like kind of protecting this pot and kind of building it up as part of this piece and component of from visiting in Washington State. And I know private dollars maybe aren't as available in this realm as they maybe once were. Does getting rid of the account kind of make that less possible for the future? If like how would those changes be affected kind of as those future forking paths come up?
Right. Well, I
Yeah,
think if you eliminate the account and you wanted to commingle um, private dollars and state dollars in the future to have an account, then you'd have to recreate an account to do that. But in separating out the state and the federal dollars, you wouldn't need to do that. You could just, continue to keep an account that has the state dollars in it. So.
And just one logistic piece. Private funds are still raised. They do not flow through the account. There is no process by which, at this point to date, that private funds have been kind of processed through DCOF's accounting system. They're all held through the private partner at this point. So just wanted to clarify that is not part of kind of what's in question at the moment, I guess.
Chloe, did that answer your questions?
Yeah, I think so. I think I'm following like the separation of the accounts a lot better than the elimination of the count. I'm still not caught up to everybody's, I guess, about why that would be a favorable option or what that would look like. But I'm also very much not an expert in anything financial, so I might just need a couple extra minutes to learn all the things.
Thanks, Chloe. Just to be clear, we're not recommending elimination of the account. I think it would potentially carry additional complications that we're not, like those raised by Erica. What does this do to the other parts of the statute that we're not interested in messing with? But yeah, given that in terms of the financial pieces of the statute, given that the legislature has been treating this as in the last couple of legislative sessions, and we're likely to see a down budget cycle for quite some time, the legislature has been treating this as though it's a line item account in terms of sweeping our funds every year. So it would just revert to allow them to do that formally. Yeah, change in terms of your question, Chloe, in the chat, change would be helpful. Yes, we think there's vulnerability with the way the account is now, that it's continuing vulnerable. It continues to be vulnerable to sweeping, and it continues to be vulnerable to the kinds of misunderstandings that Julie mentioned, where staff and legislators look at the account, federal and state funds. It's unclear what the agency has authority to spend. They want to change authority for spending in ways that aren't helpful. It just reduces confusion, I think, on everybody's part.
Okay, I want to just give a minute, any public or TRIO member questions before we move into breakout groups. Martha, go ahead.
Thank you. So I noticed on one of the slides it said this would not affect any of the contracting. And I guess my question is, would it allow in the future for multi-year contracts either with LIAs or state partners?
Do we currently have multi-year contracts? We don't, do we?
No, we have single year contracts. And I don't know, I mean, typically the cycles for contracts don't extend beyond the biennium anyways, because the agent, the state doesn't know what the budget cycle will look like beyond that. So it hasn't the contracting cycle is not so much tied to the account. It is more tied to the overall budgeting cycle, is my understanding how I would describe that. So it's a good question. I don't know if we could get beyond biennial contracts, and it would be more around agency process and policy. Does that answer, Vicki? Please go ahead.
Yeah, I think you're right. The process of annual versus biennial contracts is more linked to agency process rather than to this account. So we wouldn't anticipate any change to that, Martha, based just on this change to the account structure.
Okay, thank you. I guess as a contracted partner, moving to a 2-year contract with the biennium would just reduce a lot of the extra, administrative burden, I assume, for the state as well as all the LIAs. So just a food for thought for future. Thank you.
Okay, anything else? Otherwise, we'll move into breakout groups for about 15 minutes. And I'll do a quick reminder of who's facilitating which groups.
Who's the one that's right?
Okay, one more second, give people a chance to ask any other questions or raise any other pieces. I think there's some action in the chat too. Sorry about that. Thank you, Erica. Thank you. We'll make sure the final slides are the ones that get posted online as well. Okay. Okay. All right. Jessica Spencer, who is my hero today, is going to move us into breakout groups here in just a second. So group one facilitating will be myself and Cynthia. Jessica's going to take notes in our group. And then group two, Vicki and JP are going to be facilitating, and Megan will take notes. And in group three, which is our public and trio group, Nicole Parker will be facilitating and Malia will be taking notes. So 15 minutes, which gives us about till 11:40-ish. And then we'll come back for any discussion. And if those folks who I just mentioned who are facilitating are taking notes, don't have the link to the shared document for note taking, please let me know and I'll make sure you get that. Everyone should have it. But if not, please send me a quick note and I can make sure that you have that link as well. All right, let's do this. 15-minute breakout groups and then a share back. Okay, we were spooked back in the middle of our conversation. I don't know if others were as well. So I want to give everyone a minute to get their Zoom feet back on the ground after getting swept out of the breakout groups and ask if we just want to spend a few minutes doing share outs and what you heard, anything you learned in that conversation. And Cynthia and I were in a group together. Cynthia, is there anything you want to share from our group? Group members, please also jump in as well. And then we'll go to Vicki and JP's group.
Yeah, I'll just share some highlights. I think our group had a really good conversation about really some more implications of the option one that was shared. And Erica was really clear about, her concerns in terms of option two. And we discussed, what the department's position is on those options, and that we really do intend to maintain all of the partnerships the way that they're set up. And it really is about efficiencies in terms of what we're proposing with option one, and that's what we're supporting at this time. And Erica had some very articulate points to share, and I invite you to add those to this conversation if you'd like, Erica, because I think that those would be helpful for the whole group to hear. And also we committed to capturing that feedback and making sure that we share it back.
Thanks, Cynthia. I'll just share real quickly that again, I represent the Home Visiting Advocacy Coalition, so I want to be really clear about my representation here. And JP had shared a little bit about the potential recommendation to break out the federal and the state. So our group had been able to review and talk about that. So, our group definitely saw the potential for administrative efficiencies and clarity associated with that option. We were not aware of the second. So I wanted to be clear that the comments that I was making there was not representative of that group because we hadn't talked about it. But I did raise the potential for unintended consequences. Hadn't, of course, seen potential bill language, of course. So I just wanted to be really careful that any language that in any way de-emphasize the value of home visiting, obviously something that everyone on this call certainly prioritizes. So I think that would be a risk. We wouldn't, given that the current statute references the home visiting services account throughout the language, I think there could be risk of unintended consequences of, minimizing the role, say, of valued trainings of the role of this advisory committee, for example. So I would say that, going forward with the effort to create the administrative efficiencies with separating out the federal and the state funds felt like the wiser approach right now, particularly during a very intense legislative year, that simplicity seemed very wise. Thank you.
Thank you, Erica. Laura, that pretty much wraps it up for our group, unless there's anything else anybody wants to share.
Christy, Gretchen, Jake, anything else you want to share? Otherwise, we'll pass it over to Vicki and JP. So give it just a second if they want to come off mute. Otherwise,
I'm going to let JP speak. I was not in a breakout group, so we'll let JP speak.
Our conversation was really about concerns regarding elimination of the account. We talked about unintended consequences related to that. We talked about the difficulties with accounting is if we were to stay the same. It seems like, separating the state and federal would be beneficial. Everybody understands the challenges of accounting in different fund streams. But I think that there's significant concern with having the possibility of the account being eliminated. Alicia or Samantha, or Chloe, do you have anything you wanted to add on?
JP for reporting out. How about Nicole and Malia were facilitator and note taker for the non-member group? Anything you want to share from that discussion or group members that were there?
I can start. So we did not have a lot of notes. There was one strength that separating it would provide more clarity, and that it seems like these conversations come up a lot during HVAC meetings, and that separating it might make it more clear, and that was a strength. There was also a comment about 2-year contracts, and that would just make things a lot easier on DCYF and its contractors. And then people were wondering if there would be how much time they have to provide feedback, because some people wanted to be able to explore and investigate this a little bit more to understand it a little bit better. And they were also wondering about the history of this decision and why it came to the table. And they wanted to know a little bit more of the history around that. And did I miss anything?
Yeah, just one more thing. We also had a question about how could there be a chance that someone in the legislature would want to alter other pieces of the RCW if we open it up? And we just Julie shared that, as long as we have a tight title about what the, specific request is, and then be in communication with partners about it, that I'm hoping that that won't be an issue.
Thanks, Nicole. I'll try to answer the question of the history of why this question has come up now. It's really related to what we've seen the last two legislative cycles. In a down budget, the legislature is sweeping everything, and we're trying to protect the account from sweeping. The administrative inefficiencies that are created by the account create some confusion, as Julie spoke to, the confusion among legislative staff and legislators about what authority is there to spend. It also invites the opportunity to change out that authority. It creates confusion it can create confusion in our own administrative staff as to what we have authority to spend. So we're really trying to protect the fund from future sweeps as much as possible. Thanks.
I think that this is our last slide. Any closing thoughts? Anything either the DCYF folks that have joined us to talk about this today, or HVAC members want to just put out there on the table before we close out? Jessica's already put the survey in. And remember, the survey is both about the meeting and about the small groups, and any suggestions for people into that or memberships. So just wanted to note that as well. So I'll just pause for another minute or two to see if there's anything else that DCOF folks want to share or HVAC members want to offer before we close out.
Oh, I have a question. Thank you, Laura. What are the next steps for this?
And by this, I think you then mean
Sorry,
this request legislation. That's okay.
Agency request legislation.
Yeah. Well, I can say what I think, but I would also ask for my colleagues to jump in. But I think we take this feedback and then put what we've heard from you all in consideration for what we put in the decision package process, or the agency request legislation, which looks like a decision package, as we move it forward through the process. And I think that's the next step, but maybe Julie or JP can jump in.
Go ahead.
Yeah, and I could, what we can do next is share draft language with you, so we can get your feedback on draft language. Our next steps are to kind of finalize the language that would go into the bill, and then we have an AG review it, and then we get a memo saying there aren't legal problems. With that, and we submit it along with a template to the governor's office in September, when we submit all of our decision packages. And then, after that, whether or not this would move forward is entirely up to the governor's office. And so we have, we won't know probably until November or December whether or not we get their stamp of approval for moving forward with it. So those would be our next steps.
Thank you, Julie. And Allison, I saw you had a question. You weren't, you had to leave for a little bit, so missed this last section of the meeting, and want to make sure you have an update on that. So I saw that request, and I'm happy to stay on for a minute to share that with you as well.
Thank
you. Yeah. Okay, anything else? New order. Please do complete the survey or meeting feedback form. And for those of you that said yes to a subcommittee or subgroup, I got a work group. I got to get that language right in my head. Please expect an email in the coming days. And also, I just want to do a huge shout out to Jessica Spencer, who has been amazing. And Nellie is gone. And so she has been helping me and Gretchen and did all the breakout groups, did all the polls, has been very supportive and does the meeting feedback. So Jessica, you are a rock star. Thank you, thank you, thank you for all that you've done to make this meeting go smoothly and appreciate you a lot. So if anyone else wants to throw a kudos to Jessica, I would encourage you to do so because I was a mess this morning and Jessica's made it all seem seamless. So thank you.
Well, and she's been so flexible with us over the last couple of weeks as we've met and tweaked things and worked things around. So yes, big thank you to Jessica.
Okay, very good. Please take that survey. I am happy to stay on, Allison, as other folks jump off to give you just a quick summary of what we talked about. And then we'll close out our meeting time. So thank you. I think you can probably end the recording. And everyone, will see you soon. Watch for notes and materials to get posted as well.